Hi, this is Matt Vaughn, and this is the Medical Minute, where we focus on topics pertaining to the surgical environment. I reviewed 2 View Medis for you today. Got a lot to cover, so I'm going to jump right in and go quickly. They're both on the topic of when can health systems go back to elective surgeries. So the first View Medi is Greg McAllister out of Washington State. He was doing a patient satisfaction study during the surge in his area, and he presents some data that show that his group was able to have a patient satisfaction score of 9.6 on their 10-point scale, and he had 0 positive cases come out of that event. The next View Medi that I reviewed for you features Ryan Nunley and Mark Hamilton. Ryan Nunley, he points to the American College of Surgeons 10-point scale for health systems to go back to doing elective cases, and the AAOS 5-point scale. There's an overlap there in a couple different areas, but the one that I wanted to highlight was the one on staff safety. He then goes on to point to some data from April 15th that of the 18 million healthcare workers in this country, just under 10,000 of them had contracted COVID-19. Of that group, 55% said that they probably got it from work in terms of their exposure. And also from that group, it was interesting that over half were under the age of 44. There were 27 deaths, and just under half of those deaths were in the 65 or older category. The next speaker was Mark Hamilton. He points to data that indicates that of your asymptomatic elective patients, up to 30% of them could be positive. Now, if you add preoperative testing, you can lower that number to 6 or 7%. And he goes on to talk about AAOS suggesting that there be COVID positive and COVID negative treatment teams, and CMS suggesting that there be COVID positive and COVID negative treatment zones. So that's what I have for you today. Those links are below. Enjoy them if you'd like. This is the Medical Minute, where you give us 2 minutes and we'll give you something that might help your patients. Have a good day.